also be called a blood thinner. However, the technical term would be anticoagulant. This medication helps decrease substances that can cause clotting and keeps the blood flowing smoothly throughout the body. Warfin is often used to prevent blood clots from forming in the body. Prevention of blood clots can help to reduce the chances of a heart attack or stroke. Some conditions that are treated with warfarin include heart attacks, irregular heart rhythm, heart valve replacement, deep vein thrombosis, and surgeries such as hip or knee replacement. Always follow your doctor's instructions on how to take this medication and always take it as directed. This medication can be taken orally with or without food, usually once a day. The dose is based on the patient's response to treatment, lab work, and medical condition. Try and take warfarin consistently. It's best to take it at the same time every day. It is important that no dosages of this medication are missed. If a dosage is missed within 12 hours of the time you were supposed to take it, take the dosage as soon as possible and continue with your usual schedule. If it's been longer than 12 hours, then wait and take the next pill until when the next dosage is due. Be sure to let your doctor know if a dose is missed. Be aware of foods you consume that are rich in vitamin K, since vitamin K can cause warfarin not to function properly. Some of the foods that are rich in vitamin K include green leafy vegetables like spinach, kale, and broccoli. Green tea and cranberry products are also high in vitamin K. Your dose of warfarin can be adjusted based on the amount of vitamin K, which is typically in your diet. So be sure to be consistent with the amount of vitamin K you consume. The most frequently seen side effect with warfarin is bleeding. Bleeding can range in intensity from being very mild, which may include an increase in bruising, to potentially life-threatening. Your physician will likely recommend a routine blood test, measuring of the INR, to be sure that the dose of warfarin is just right. Your doctor will monitor the balance between having blood that is too thick and can increase your risk of a blood clot, or too thin, which can increase your risk of a bleed. You should also monitor for symptoms that could indicate you are bleeding. Symptoms might include pink or dark urine, vomit or coughing blood, unusual nosebleeds, dizziness or fainting, unusual tiredness or weakness, bright red or black tarry stools, shortness of breath, or chest pain. Some symptoms can also occur if you have a blood clot, and they include pain, typically in your legs or chest, or severe headache. Call your doctor right away if you experience symptoms of bleeding or a blood clot. Alert your physician if you are allergic to this medication or have any other allergies. Give your doctor a medical history, especially a history of blood disorders, recent injury, major surgery, liver disease, frequent falls, or alcohol use. Always inform other physicians and dentists that you are taking warfarin. If you are taking other prescription or non-prescription medication, vitamins or herbal supplements, they could interact with warfarin. This can cause the medication to not work properly and increase the risk of side effects. To be safe, always keep a list of everything you are taking and share it with your pharmacist and physician. And always ask your physician or pharmacist before adding any new medication or supplement to your regimen.